Hi, welcome to this podcast. The focus of this podcast is the critical question, how is injury rehabilitation managed? In this podcast, you will learn about rehabilitation procedures. These include progressive mobilisation, graduated exercise, which includes stretching, conditioning and total body fitness, training, and the use of heat and cold. Progressive mobilisation. The aim of progressive mobilisation is to restore full range of motion after the application of the Reiser principle. This is achieved by gradually extending the range of motion through which an injured joint or muscle can be manipulated until it is fully functional. This slide illustrates each of the progressions in order to achieve full mobilisation after injury. Progression should be managed according to the relative pain-free range of motion the athlete can achieve at each step in the program. Take a moment to review each of these steps by pausing the video. Remember that isometric contractions refer to the ability of a muscle to generate a force without either shortening or lengthening. In other words, the ability of a muscle to apply a force while the joint is fixed, such as pushing against a wall. Graduated exercise. Graduated exercise involves stretching, conditioning, and the achievement of total body fitness. Stretching promotes healing without scarring. Scarring shortens muscle and makes it prone to further injury. Proprioceptive neuromuscular facilitation, or P&F stretching, is the most appropriate style of stretching for graduated exercise purposes. P&F stretches involve the athlete stretching against a fixed resistance, that is, an isometric contraction. This is followed by a relaxation of the muscle before increasing the range of motion in the joint and stretching once again. These illustrations show some examples of P&F stretches. You will note that each involves the use of a partner or an elastic band to assist with the isometric contraction. Conditioning. The purpose of conditioning is to adapt the body to a range of agility, strength, and power skills. These skills include running, hitting, and kicking, with the aim to improve an athlete's fitness. In order for a conditioning to be effective, the athlete must be free of pain. Exposure to game skills in non-competitive situations where the full range of motion is required is the main aim of conditioning. Two important principles need to apply to effectively condition an athlete. The first is the principle of overload. Overload describes the gradual increase in work or intensity to achieve the maximum fitness benefits, that is, cardiovascular endurance, strength, and/or flexibility over time. Periods of rest and recovery are followed by periods of gradually increasing periods of work. Generally, these increased periods of work, or intensity, should be no more than 10% of the previous load effort to avoid overtraining and possibly re-injuring the athlete. The second principle is that of specificity. This describes the specific muscles, movements, and energy systems that are used by the athlete and which are particular to each sport and position the athlete plays. When returning from injury, it is important that conditioning programs take this into account so that these are developed appropriately for the sporting demands faced by the athlete. Total body fitness. The aim of total body fitness is to regain both mental and physical fitness reached prior to the injury occurring. Programs must be progressive and gradually overload muscles and energy systems with an aim to both rehabilitate but also to increase the following. Firstly, the hypertrophy of muscles, which is the increasing diameter of the muscle, the strength of muscles and tendons, increased capillarization and subsequent blood flow to the area, the elasticity of muscle fibers, the absence of all pain, full match confidence, and finally restoring both balance and coordination. Training. Full training can resume after total body fitness. Training must occur in a totally pain-free environment for the athlete. Full training includes all components and may require some specialised programs. These programs include resistance training, strength and conditioning, aerobic work, plyometrics, stretching, and strength and mobilisation activities. The use of heat and cold. Cold therapies, also known as cryotherapy, reduces inflammation and swelling by reducing blood flow. Some examples include ice massage, where ice is rubbed gently over the injury for up to 15 minutes at a time. Ice water immersion, where the injured area is placed in a container of iced water for short periods of time. And vapocoolant sprays. These are sprays which cool affected areas quickly and help prevent muscle spasms. They act like a local anaesthetic. Heat therapies, also known as thermotherapy, is the application of heat in various forms to the injury. When internal bleeding has stopped, this may take up to about 48 hours after the injury to occur, and heat should not be used before this has been achieved. Heat may be used to achieve some of the following: an increase in elasticity to the new fibres during the stretching process, a reduction in pain and a reduction in stiffness, an increase in blood flow, and also a reduction in inflammation. Heat energy is transmitted through radiation, convection, and conduction. It may be applied using superficial techniques such as heat packs or penetrating therapies such as ultrasound. Some examples of the most commonly used methods for heat application include moist heat packs that contain a silicate gel. These are applied to the injury with towels used as insulators between the packs and the injury. Whirlpool baths or spas, where the injury is immersed in a small spa bath containing water at the desired temperature, which may be hot or cold, and the injury massaged by the movement of the fluid. Contrast baths, where the water temperature is alternated after 5 minutes or so between hot and cold. This increases local circulation by causing vasodilation from hot water and vasoconstriction from cold water. These affect the capillaries in the injured area. Microwave diathermy. This is used to heat deeper tissue, particularly tissue with a higher water content, such as muscle and blood. With a towel placed over the skin, the tissue surrounding the injury is heated to approximately 42 degrees, and this temperature is maintained for a period not exceeding 30 minutes. And finally, ultrasound therapy. This uses high-frequency sound waves to produce heat energy. This is most effective in denser tissue, such as bone and ligaments. As a result of listening to this podcast, you'll have learned about these various rehabilitation procedures. It's important now to complete the activity found in Edmodo in order to help you to examine and justify various rehabilitation procedures that are used for some specific injuries. The syllabus specifically looks at hamstring tear and shoulder dislocation. You'll find these in Edmodo, and these activities will be completed in class. Thank you for taking the time to listen to this podcast on the rehabilitation procedures. The critical question: how is injury rehabilitation managed?